Hello, everyone. Thank you for joining today's 2023 MIPS Overview webinar. During today's webinar, CMS subject matter experts will provide information on ways to participate in MIPS in 2023, including MIPS eligibility requirements, participation requirements, and requirements for the participation in MIPS via the Alternative Payment Model Performance Pathway, or APP. This presentation will be followed by a Q&A session where attendees will have an opportunity to ask questions via phone in the Q&A box, and CMS subject matter experts will address as many questions as time allows. Also, to note, the slide deck and recording from today's webinar will be posted on the QPP webinar library within the next 2 weeks. Now, I will turn it over to Katie Moore at CMS to begin.
Great, thank you, Olivia. And good afternoon, good morning to everybody on the line today. Thanks so much for joining. So today we are going to cover our 2023 MIPS Overview webinar. So this is really going to kick off our educational webinar series. So we have this one today. And then if you aren't aware, we're going to have a couple deeper dive performance category webinars. We set them every 2 weeks for the next couple months into May. So we have promoting interoperability and improvement activities on May 10th, and they will all be same time. So 1:30 to 3 o'clock every 2 weeks. If you want to hang out with CMS, this is where we'll be. And then we have our cost and quality performance categories will be on May 24th from 1:30 to 3. So if you haven't seen the registration information for that, I believe we either have it up right now or will today. Make sure that that is available on our QPP webinar library so that folks have one place to go. But if you haven't already signed up for our QPP listserv, encourage you to go ahead and do that. That's where we send out all of the information when we have these kind of events or when we have additional information about the program. So encourage you to get signed up on our listserv. If you go to qpp.cms.gov, at the bottom of the page, you'll be able to put in your email address. So thank you guys all for joining us this afternoon. I know we have a lot of clinicians on the call today, and then as always, the staff that supports them and keeps everything running at the different practices, as well as our society advocates and different folks that are involved in different aspects of the healthcare system. So I always like to start these presentations by just saying thank you for all that you all are doing, interacting with patients and making sure that they're getting the best care that we can possibly give them and improving their health and their overall wellness. So just thank you so much for everything that you do every day. So just a level set on today's presentation, I know that our program has a lot of overlapping years and different requirements and different parts of the program that overlap. So sometimes we get a little, even at CMS, we get a little confused on which performance year we're talking about. So we always want to start with kind of anchoring what we're talking about and wanted to make sure that everybody's aware of this presentation today is going to really focus on our 2023 performance year, and we're going to focus mainly on the MIPS part of the quality payment program. So we'll get into some more details on what that means throughout the presentation, but just wanted to make sure we all have that mindset and focus when we're talking through all the different requirements and things today. And when you're asking your questions, if we can try to keep them focused on this performance year, we would really appreciate that. And as our team has pointed out in the chat, I wanted to make sure folks were aware that we have our catch-up team. I think Sam today is going to be sharing links throughout the presentation. They're like magic. They just pop up as we're talking about things so that everybody has the relevant resources that the speakers are referring to. So just keep an eye on that. And but don't worry if you miss it. We will have all of that information available towards the end of our presentation. all the links and everything you need to get to the resources that you need. And as I think we already said in the chat, and I think Olivia mentioned as well, these slides will be available as well as the recording in the next couple of weeks on the QPP webinar library. So don't worry about furiously trying to copy down all of the information that is being shared today. We'll make sure you get what you need over the next couple of weeks. We do have a number of our subject matter experts on the line today. So I want to say thank you to them for participating, being here, and answering questions throughout. So you don't have to wait for the Q&A session at the end. I know we have, it looks like about 1,200 participants today, so that's great. I'm glad we've had such a high turnout, but don't think you have to wait for the Q&A session. Please go ahead and start submitting any questions, and we'll try to answer them as we go through the presentation and get to as many as we can. So real quick here is just our run of show for the day. So we'll go through just some basic eligibility information, as well as reporting options overviews. And we know that we have kind of a mixed group on these overview presentations. We have some folks that are brand new to the program and are just trying to get some basic information and understanding to get started in MIPS. And then we have some old friends that have been here with us over the past 7 years. So apologies if some of the information is not new for you, but I hope our goal today is that everybody comes away learning something new or gets a question answered that they've been trying to figure out. And then we'll go through some reporting requirements and then some helpful support information on our ending slides, or how you can start engaging more with QPP, some different opportunities we have available. And then, as always, we will end with our Q&A session. Okay, next slide, please. Great, thanks. So at first, we just wanted to highlight a couple of exception applications that will be available soon. So we have our Promoting Interoperability Performance Category Hardship Exception application. This really allows you to request reweighting specific to the Promoting Interoperability Performance Category. So just requesting that one category gets reweighted to 0%. And then our second one, I think folks have gotten familiar with over the past couple of years, but is our Extreme and Uncontrollable Circumstances Exception application. And this really covers the gamut of anything that could be going on that is outside of your control, that is impacting your ability to participate in the program. So whether that is a natural disaster or just a disaster that happens to you specifically. And then as we've seen over the past couple of years, we've applied this application to our public health emergency for COVID as well. So different things like that are applicable for this application to make sure folks that need it get the relief that they need. So both of these applications will be opening very soon, and they will remain open until the end of the performance year. So I believe the deadline is January 2nd. So more information to come on those. Again, subscribe to the QPP listserv, and you'll know first when that information becomes available. And with everything we talk about today, there's somewhere on our QPP website, if you go to qpp.cms.gov, that has more information typically about what the different information we're talking about today. So encourage folks, if you haven't already, just go through that website and check out the different information. But we have a whole page on exception applications and where to go and things to do. Next slide, please. Okay, this graphic should be familiar to many folks, even newer folks. We included in a lot of our resources just to give that very high level visual of what is the Quality Payment Program. So the Medicare Access and CHIP Reauthorization Act of 2015, that we refer to as MACRA, created the Quality Payment Program, which is made up of two participation tracks. So the merit-based incentive payment system, which is where we are focusing today's presentation, and then our advanced alternative payment models option. Next slide, please. Okay, and this slide breaks down second track a little bit. We were having some confusion from folks about, you know, I'm in an APM, do I participate in MIPS? How does that work? So, you know, our MIPS eligible clinicians that are participating in advanced APMs, some of them, a good majority of them, are required to participate in MIPS. So typically, unless you earn QP status or partial QP status, you are required to participate in MIPS. Next slide, please. So here's just some very basic information for 2023. So there are 4 performance categories, and in a couple later slides, we'll go into more detail on those different slides. We have our wonderful experts on the line to talk through each of these in a little bit more detail. But basically, you report, measure, and activity data for quality, improvement activities, promoting interoperability, performance categories. And then CMS, we calculate your cost, we collect your cost information through admin claims, and we calculate that data for you. So you don't have to submit anything to us for cost. We collect that information for you. So we have a final score. So your performance across these different 4 performance categories, you'll receive a score from 0 to 100 points. And then those points, each performance category has a different weight that we'll get into, and those points help determine your final score. And then there's an associated payment adjustment. So MIPS final score will determine whether you receive a negative, neutral, or positive MIPS payment adjustment. And payment adjustments are based on your performance for 2023 and applied to your Medicare Part B covered professional services, so starting January 1, 2025. So there's always this 2-year delay. So there's your performance year, and then there's an associated payment adjustment year. And we'll get into a little bit more on how that gets determined, I think, in a later slide. Next, please. Okay, so for 2023, again, we're focusing on this performance year. Under MIPS, there are really 3 reporting options for 2023, and this is unique, and we have some new and exciting ways to participate in the program this year. So the first option is traditional MIPS. So this is what we refer to as really the original MIPS reporting option and how folks have historically participated in the program. So you select your quality measures, your improvement activities from our really large inventory, and then you report the complete promoting interoperability measure set. And then again, we collect that cost information and we score that based on, you know, if you meet or exceed the established case minimums for the different cost measures. So that is historically how folks have participated in this. So beginning in 2023, if you haven't heard about this new part of the program, it's called MIPS Value Pathways. It's a new reporting option for 2023. And we're going to touch on MVPs throughout today's presentation, but just wanted to highlight we have an entire web page dedicated to all things MVPs for folks that want to get a little more detailed information on MVPs or how they came about and how we're working towards transitioning to MVPs. And this is really the future of the direction of the program. So encourage folks to check out that website. We have some great resources and then links to past webinars. We did one right at, I believe in December last year, right before the start of this performance year. Our MVP kickoff webinar we do at the beginning of before each performance year that really goes into a lot more details on the available MVPs for 2023 and just all the different processes that are associated with MVPs. But just as a high level, what this really is, we've heard a lot that over the past few years that there's just too much choice. There's too many options in traditional MIPS, and they really aren't getting at measurements specifically for specialists and different areas. So what we've decided to do is we have created these MIPS Value Pathways, which is really a more meaningful way for clinicians to participate in the program. And it groups measures and activities that are really relevant to how clinicians practice. So they're grouped around different specialties and medical conditions, so we can really make them relevant to how different types of clinicians provide care to their patients. And then we'll be able to have data that is really more comparable across different specialties and just really makes more sense. And so currently for 2023, I'm not going to get into too much details, but there are 12 MVPs available right now, and we have a slide later that will get into more information about registration, but just wanted to flag here that you do have to register if you're planning to participate in an MVP. So once you're registered, clinicians will select from a more focused set of quality measures and activities that really relate to their specialty or medical condition that they work with patients on. And then clinicians will be scored on every cost measure that is available in their selected MVP for if you meet the case minimum for the measures. And then our third option for MIPS is our APP, which is the Advanced Alternative Payment Model Performance Pathway. And I know we have our some CMMI colleagues that will go into more details on the APP in future slides, but really it's a streamlined reporting option that has a specific predefined measure set that's only available to MIPS APM participants. So if that is how you participate in QPP, this would apply to you. And the APP is really designed to reduce reporting burden and encourage participation and facilitate movement to APM. Next slide, please. And so this is just a timeline of how I said before that the program the years overlap. So this is a great slide to kind of put that on paper. So what we're focusing on right now is this is the calendar year 2023 performance year. So it began on January 1st and closes December 31st. And clinicians, so this is where you are caring for your patients and collecting all the different data throughout the year that you'll need to submit to CMS in the beginning of 2024. So 2023, you're just participating by taking care of your patients. And then data submission opens January 2nd, 2024, deadline of April 1st. And don't worry about these deadlines right now. We'll send out plenty of reminders when they get closer. But just to put perspective on the program. So then data submission is at the beginning of 2024. CMS will provide you with performance feedback typically and around the summertime timeframe. We provide feedback in 2024, and then your MIPS payment adjustments will be applied starting in calendar year 2025. So again, there's that two-year delay for payment adjustments. Next slide, please. Now I'm going to go through, I think, the next few, try and just hit them really quickly because I don't want to take we have a lot more slides to get through and want to keep moving. So we'll try to talk not too fast, but just keep us moving here. So this slide shows the performance category weights that I mentioned before. So for 2023, the quality performance category will be 30% of your MIPS score, cost will be 30%, improvement activities will be 15%, and promoting interoperability will be 25%. And then traditional MIPS performance category weights for APM entity participation is 55% for quality, 0 for cost, 15 for improvement activities, and 30 for promoting interoperability. Next slide, please. And then this slide, this is geared towards all of our clinicians and staff that work in or with small practices. So we do slightly different performance category weights to support small practices, because we know there are definitely some unique challenges with being a single and solo practitioner. So we always have promoting interoperability is always automatically reweighted to 0%. And then this graph just shows, or this diagram just shows where that reweighting happens. So the standard weighting for small practices, quality is 40%, cost 30%, improved activities 30%. And then when both the cost and PI performance categories are reweighted, then the reweighting shifts to 50% for quality and 50% for improvement activities. Next slide. And then real quick, the APP performance categories are slightly different. So we wanted to make sure folks were aware of this distinction. So for APP specifically, quality is 50% of your MIPS final score, 0% for cost, and then 20% for improvement activities and 30% for promoting interoperability. Next slide. Okay, next slide, please. So the next few slides, we're going to go over eligibility. So when you're starting a program, how do I know if this even applies to me? Am I eligible to participate? Am I required to participate? So first off, we start by identifying if you're a MIPS eligible clinician type. So we have a number of clinician types that are included in MIPS. And then we look to see if you've exceeded, so gone beyond, all three elements of a low volume threshold criteria that we've established during a specific determination period. And I'll get into that a little bit more, I think, in the next slide. Then we confirm if you were enrolled as a Medicare provider before January 1st, 2023. We confirm that you're not a qualifying APM participant, so QP or partial QP. And then if you meet these criteria, you will be required to participate in MIPS. And there is, again, here at the bottom, and then I think in the chat, are a number of links and different things to see just really quick eligibility and participation, quick start guides. Next slide, please. And this is a new graphic. This is just some really basic exemptions. So if you're newly enrolled in Medicare, if you're not an eligible clinician type, if you're below the low volume threshold, or if you significantly participate in an APM, an advanced APM, and achieve that partial or QP status, then you're excluded from MIPS, which means you are not required to participate in MIPS. Next slide, please. Okay, so here's a little bit more about that low volume threshold. So there are no changes to the criteria for 2023. So it's the same that you participated in 2022. So if you exceed the low volume threshold and are MIPS eligible clinician type, if you bill more than $90,000 a year in allowed charges for covered professional services, and if you see more than 200 Medicare Part B beneficiaries, and if you provide more than 200 covered professional services to Part B patients. So those ands are bolded for a reason, because you have to meet all three of those criteria to be eligible and required to participate in this. Next slide, please. So the MIPS determination period, we talked about this a little bit. So there are two different 12-month segments that are aligned to fiscal year. So the first segment we look at, which means we're looking at all the different information to see if you meet those three criteria that we just laid out. So the first determination period is October 1st through 2021 through September 2022. This is the historical period. And then we have a second segment where we look at October 2022 through September 30th, 2023. So those two different fiscal years. Next slide, please. Okay, so what happens if you're not eligible, if you don't meet all three of those? You have a few different options. So you can voluntarily participate in traditional MIPS only, so which means you will submit data to CMS and you'll receive feedback during that performance feedback period next summer. You won't receive a MIPS payment adjustment. And this option is really good for folks that think you may be required to participate in a future year and just kind of want to start getting involved with the program, just to because you'll most likely be required to participate in the future and want to just kind of get a feel for how things work and try it out. Our second option is our opt-in option. So this is for traditional MIPS and APP only. So this is for clinicians that are eligible to opt in if they meet these criteria. If you're identified as a MIPS eligible clinician type on your Medicare Part B claim, if you've enrolled as a Medicare provider prior to 2023, if you are not a QP or a partial QP, and you have to exceed at least one of the three low volume threshold criteria. So either above $90,000 in covered professional services or 200 patients, or I'm blanking on the third option off the top of my head, but you have to exceed at least one of those to be able to opt in. And then practice is eligible to opt into MIPS as a group or part of a virtual group if you have at least one of the clinicians in your group or virtual group that is identified as a MIPS eligible clinician, enrolled as a provider before 2023 and are not a QP. So you have to still exceed one or two of the three low volume threshold criteria, but at the group level. Next slide, please. Okay, this is a very important tool, and if you have checked out our QPP website, you have most likely seen this. So it's right on the front page of our homepage, and it's the easiest way to quickly check and see if you are eligible to participate in MIPS. So you just go ahead and put in your NPI, so your national provider identification number, enter that, and then click a button, and it will show you if you are required to participate in MIPS, or show you how you are eligible to participate in MIPS, either individual or group. So a lot of great information if you haven't already tried that out. Encourage folks to check out that great tool. Next slide. So we get this question a lot. What happens if I'm associated with multiple practices in the QPP participation tool? So this means if you reassign your billing rights to multiple TINs, so tax identification numbers, you'll see associations to multiple practices. So a lot of different, all of the information about you will show up in this practice status tool. And what we do is we evaluate you for MIPS eligibility associated practice. So each TIN NPI combination. So you will receive a payment adjustment based on the 10 NPI combinations where that low volume threshold that we just went over was exceeded, either as an individual or as a group, if the group reports data on your behalf. You won't receive a payment adjustment at any associated practices where you didn't exceed the low volume threshold. So basically, the tool will show you each of the ones that you're associated with and what your eligibility status is for each one separately. Next slide. And we can go one more. I'm just going to run through our participation overview. So there are 5 participation options or different levels that you may collect data and submit it to CMS for MIPS. And the participation options are available to you depending on that eligibility status we talked about. So you can either participate as an individual, and this chart's really helpful because it shows you then which reporting options are available to you based on which level you choose to or are able to participate. So there is the individual level, group level, virtual group, subgroup, and APM entity. And then those are the associated options that are available with each of those participation options. And just wanted to flag that this subgroup option is brand new for 2023 and is only available for MVP reporting. Subgroups are a subset of clinicians in a group which contains at least one individually eligible MIPS clinician. And I know this has been a hot topic in recent years, and I know folks are hopefully excited as we are to be able to offer this and really get that information down to that subgroup level. And currently, folks that want to opt in or voluntarily report cannot participate in an MVP for 2023. So just wanted to flag that as well. Next slide. So for each of the different performance categories, each one has a different, well, not each has a different, but there are some of them that have different reporting periods. So we just like to highlight that quality and cost are 12 months performance period, whereas promoting interoperability is 90 days, so any consecutive or continuous 90-day period. And then there are several improvement activities that require different things like completion of modules, where they're also a year long, but typically the most of them are again for this 90-day continuous period. Next slide, please. Okay, I'm not going to read through all of this information, but just wanted to highlight this is how data submission for MIPS eligible clinicians, whether you're reporting at that individual group or virtual group level. So this just lays out all of the different options that are available to you and how you can submit information to CMS based on the different performance categories and then the different levels at which you're able to submit it to CMS. Next slide, please. And one more, thank you. Okay, so we spoke earlier about those different points that you're going to be earning for the data you're submitting to us for each of the performance categories. So 75 points is our performance threshold. And what this means is this is the minimum final score clinicians need to avoid a negative payment adjustment and to earn that neutral payment adjustment. And this applies to all three MIPS reporting options. So whether you participate in traditional MIPS or MVPs or through the APP, 75 points is that goal for a neutral payment adjustment. And if there are multiple final scores that are associated with your TIN NPI combination, we will apply the same scoring hierarchy that we've used in the past in 2022. So if you're in a virtual group, you'll get the virtual group final score. Otherwise, we will assign the highest final score available from any of the reporting options or participation options. So we want to give folks the benefit of receiving scores and associated payment adjustments based on the highest final score we have associated with you. And then we'll compare your final score to that performance threshold to help determine your payment adjustment. And just a note here to flag for folks that aren't aware, hope everybody's aware, but just to flag that 2022 performance year and the associated 2024 payment year was the final year we had that additional adjustment for exceptional performance. So that is no longer available for 2023. Next slide. And this here is a really great quick breakdown of our payment adjustment and how that's associated with different final scores. So 75, again, is that goal for a neutral payment adjustment. If you score 75.01 or higher, so up to 100 points, you will receive a positive payment adjustment greater than 0%. And reminder that, again, there's no additional payment adjustment for exceptional performance. So for folks that are new, in the past, we had additional funds that would be for clinicians that scored above an exceptional performance threshold, and we no longer have that in the program. An important fact to make sure everybody is aware, if you're new to the program or otherwise, just to remind folks that the quality payment program is So MIPS is a budget neutral program. And what that means is the amount of positive payment adjustments that we are able to provide have to equal out based on how many negative payment adjustments there are, so that the program is neutral, that we meet at 0. So the positive payment adjustments, the amount we're able to provide to clinicians is based on the number of negative payment adjustments that are also associated with the program. So just wanted to make sure that folks were aware of that, and that was established through the statute, so through MACRA. We have no flexibility on that. So this is just the framework within which we operate. So if clinicians receive a final score that is lower than 75 points, so 74.9, negative payment adjustments could be between -9% and 0%. And then again, if it is lower than that, it could be up to negative payment adjustment of 9%. Next slide. Okay, I'm sure that everybody needs a change in hearing somebody else speak at this point. So thank you for hanging in there with all of that basic information. I'm going to go ahead and turn the presentation over to Lisa Marie Gomez, who's our Quality Performance Category SME, to go through quality.
Great, thanks Katie for all that information to preface the rest of the presentation and the other presentations that we'll have relating the other performance categories. So as Katie noted, I will be discussing the quality performance category. So for the in the 2023 Physician Fee Schedule Final Rule, we outlined many elements relating to our measure inventory. So for 2023 performance period, there are a total of 198 measures. This inventory does not include the QCDR measures, but within the 198 measures, that inventory included 9 new quality measures, which included 1 new administrative claims measure. We also removed 11 quality measures. We also removed 2 partial or 2 measures. And what we mean by partial removal means that those measures were removed from traditional MIPS, but they were retained for utilization in MVPs. Also within the 198 inventory or measure inventory, we had substantive changes to 76 measures, which 5 of which do not have a historical benchmark. Next slide, please. And I'm going to go over the basics for traditional MIPS relating to the quality performance category. So for the quality performance category, it represents 30% of your MIPS final score. This performance category is weighted at 55% for MIPS eligible clinicians participating as an APM entity. For the quality performance category, it's a 12-month performance period. And as I noted previously, there are 198 measures, and you select 6 individual measures. 1 must be an outcome measure or a high priority measure, particularly if an outcome measure is not available. A high priority measure falls within these categories I'm about to read. So an outcome, appropriate use, patient engagement or experience, patient safety, efficiency, care coordination, opiate related or health equity related. If there are less than 6 measures that apply to you or your specialty, then you report on all applicable measures within your specialty set. There are 266 QCR measures approved outside of the rulemaking process. So those are also available for being able to select to meet your requirements for the quality performance category. And as I noted, you're also able to select specialty sets. So there are measures within a specialty set that may apply to you, and you're able to select measures that are applicable to you. And if your specialty set includes less than 6 measures, then you're required to report all measures within that specialty set. And I just want to highlight on the left-hand side of this slide that there are resources available to you that we encourage you to review in the event that you want more information relating to quality performance category. Next slide, please. I'm going to go over basic information relating to the quality performance category relating to MVPs. So as a reminder, you must register an advanced report, an MVP. For quality, it represents 30% of your MIPS final score. And if you're participating as an APM entity, your performance category weight is weighted at 55%. Similar to traditional MIPS, MVP, the performance period for quality is 12 months. Now, the requirements are a little bit different from traditional MIPS. So for an MVP, you must select 4 measures that are available within your MVP. So one must be an outcome measure or a high priority measure if an outcome measure is not available. And for small practices reporting Medicare Part B claim measures will meet quality reporting requirements or reporting all of the claims measures available in the MVP, even if there are fewer than 4 measures. And on the left-hand side of this slide, I want to highlight that there are resources available for MVP if you want more information. So we encourage you to review the resources available under MVPs so that you can become familiar with what's available under an MVP and what the requirements are. Next slide, please. Now I'm going to provide information relating to scoring updates specific to the quality performance category. So there are several changes to the quality performance category, particularly relating to scoring. So measures that can be reliably scored against a benchmark will receive 1 to 10 points. Measures without a benchmark will receive 0 points. The 3 points for small practices and traditional MIPS, and MVPs, and an APP. So again, I want to just go over this really quickly again. So whether you're reporting in an MVP or traditional MIPS, if there is a measure without a benchmark, you will receive 0 points, even if data completeness or case minimum criteria are met. However, for small practices, whether you're participating in MVP or traditional MIPS or in an APP, you will continue to receive 3 points. Measures that don't meet the case minimum criteria will receive 0 points. And again, this does not apply to small practices. Small practices will continue to receive 3 points. Measures, again, that don't meet data completeness will continue to receive 0 points, but for small practices, that again does not apply. I just want to note one element. So these policies don't apply to new measures during the first 2 performance periods available for reporting. Beginning with the 2023 performance period, we'll score administrative claim measures exclusively against performance period benchmarks. Next slide, please. Then we'll discuss achievement points. So measures can earn between 0 and 10 achievement points based on performance in comparison to benchmark and the volume of data reported. Bonus points are only available for small practices. So for traditional MIPS, MVPs, and the APP, we will continue to add 6 bonus points to the quality performance category as long as 1 quality measure is submitted. I just want to note that we, CMS, no longer provide bonus points. So reporting an additional outcome or high priority measure, you don't receive bonus points beyond what's required. Reporting measures that meet electronic end-to-end reporting criteria also do not receive bonus points. Next slide, please. I'm going to go over elements relating to data completeness. So we check to see if you submitted performance data on a minimum percentage of your patients that meet a quality measures denominator criteria. In 2023, the data completeness criteria thresholds are 70% for data submitted on QCR measure, MIPS CQM or ECQM, which means all payer data, and 70% for data submitted on Medicare Part B claims measures. So again, Part B data measures that don't meet the data completeness threshold or our criteria earn 0 points. Small practices will receive 3 points for measures that do not meet data completeness. And I just want to note that for those that are submitting something under the APP, even you still are required to meet data completeness for all measures. Next slide, please. Now I'm going to turn the presentation over to Ray, who will go over the cost performance category requirements. Ray?
Thanks, Lisa Marie. And hi, everyone. My name is Ray Desautels, and I'm the cost measure lead here at CMS. Next slide, please. So for 2023, the cost performance category will account for 30% of your MIPS final score, as Katie mentioned earlier. And similar to the quality performance category, the cost performance category has a 12-month reporting period. And there is no reporting requirement for the cost performance category. CMS retrieves all of your data from your administrative claims. And in order to be scored on cost measure, you or your group must have enough attributed cases to meet or exceed the case minimum for a cost measure. And finally, clinicians and groups can earn up to 1 percentage point for improvement scoring in the cost performance category for the 2023 performance year. Next slide, please. Next slide, please. Great. And so there are 25 cost measures for the 2023 performance period. This includes the Medicare spending per beneficiary, or MSPB clinician measure, the total per capita cost TPCC measure, as well as 23 episode-based cost measures. For MVPs, each MVP will have a subset of MIPS cost measures applicable to the MVP's clinical topic. Clinicians groups and subgroups will be scored on every cost measure available in their selected MVP for which they meet the case minimum. And if you are in an MVP and cannot be scored, the 30% weight will be redistributed. And finally, measures can earn between 1 and 10 achievement points based on performance in comparison to the benchmark. And I believe that's it for cost, so I'll now pass it over to my colleague, Michelle Peterman, to go over improvement activities.
Hi, everyone. This is Lynn Hoffman, and I'm stepping in for Michelle today. She has lost her voice, so we hope she will feel better soon. But thank you, Ray. So I will be walking us through a few key improvement activities updates for 2023. Next slide, please. So for 2023, we made some changes to the inventory. One of the changes is adding 4 new activities in the subcategories of achieving health equity, expanded practice access, and emergency response and preparedness. And those specific new activities are, the first one is adopt security labeling services for EHR data. The second one is create and implement a plan to improve care for LGBTQ patients. The third one is to create and implement a language access plan. And the fourth is about promoting COVID-19 vaccination for practice staff members. We also modified 5 existing activities, and those are EPA 10, which has to do with completing training and receiving a waiver for opioid medication-assisted treatments. And that activity was also moved from the expanded practice access to the behavioral health subcategory. We also modified activity CC Care Coordination number 13, and that one is practice improvements for bilateral exchange of patient information. That one has been modified, and the new title is Practice Improvements to Align with Open Notes Principles. Another activity that was modified was in the care coordination category number 14, and that one is focused on practice improvements, engaging community resources to support patient health goals. And that one has been moved to the Achieving Health Equity subcategory and retitled Practice Improvements that Engage Community Resources to Address Drivers of Health. And then the fourth modified activity is Improvement Activity PSPA 7, and that one has to do with using QCDR data for ongoing practice assessment and improvements. And what we've done there is incorporated some other QCDR related activities, so consolidating into that one. And then the last one that was modified for 2023 is improvement activity PSPA 19. And that one is focused on implementation of formal quality improvement methods, practice changes, or other practice improvement processes to incorporate PSPA 20, which stresses the leadership role in that. So again, that's just combining to seek to reduce burden from having just too many choices. So that's just the tidying up of the inventory there. And then we also in 2023 removed 6 previously adopted activities in the subcategories of beneficiary engagement, population management, and patient safety and practice assessment. 3 of those had to do with the QCDR activity consolidation that was just mentioned. And then the other one, or one of the additional ones in the 6 that were removed, has to do with consulting the prescription drug monitoring program, because this activity has become duplicative because there's a query of PDMP measure included now in the promoting interoperability performance subcategory, and that's measure PI EP2. And then again, I mentioned that PSPA 20 has been combined into PSPA 19, so that one was removed. And then lastly, in terms of the removals, IA PSPA 30, which had to do with the PCI bleeding campaign, has been removed because that campaign concluded at the end of the summer in 2021, so it's no longer available. And so these proposed new and modified activities help fill gaps identified in the inventory, while removal of activities is to help ensure that the inventory is best reflecting current clinical practice. And all of the new activities are responsive to the administration's goal of advancing health equity for all. And for specific details on these changes, please go to the QPP website under Explore Measures and Activities. And there you can search for a specific activity or review the Excel file that contains the entire 2023 inventory with changes noted. Thank you. This next slide is where we want to be. So this slide covers some basics for 2023, and the reporting basics for improvement activities have not changed for 2023. The category is still 15% of the MIPS final score. As we can see here on the slide, the performance period is a consecutive 90 days. In the 2023 inventory, there are now a total of 106 activities, and clinicians can gain a maximum score of 40 points in traditional MIPS if they're not in a special category, with medium weighted activities, which are worth 10 points, or high weighted activities, which are weighted 20 points, in any combination to reach the 40-point requirement. And in order to receive credit for completing any activities, clinicians need to attest to the activity during the data submission period. And we do note that clinicians are requested to maintain supporting documentation for activities attested to for at least 6 years in case of an audit. And we do also note that flexibilities for reduced reporting requirements do continue for special statuses, including small practices in those in rural locations, and also in health professional shortage areas. And if one of these designations apply, then medium weighted activities are worth 20 points and high weighted activities are worth 40. So for example, a clinician with a special status would only need to complete 1 high or 2 medium weighted activities to achieve the 40 points for the improvement activities performance category. Next slide, please. So this is looking at improvement activities basics for 2023 for MVPs. And there's one important difference for MVPs in 2023 that we wanted to highlight. The biggest difference is that the activities are double weighted for MVPs, which means that a medium weighted activity is worth 20 points, while a high weighted activity is worth the full 40 points for all clinicians, irregardless of status. And so to receive full credit in MVP, an eligible clinician may do 1 high weighted or 2 medium weighted activities for MVP. And then another note to keep in mind is that clinicians who are choosing to participate in MVP choose from the activities that are listed in that particular MVP rather than from the entire inventory. And so we do suggest that you closely review the MVP that your practice has chosen to report on for the applicable activities. And again, we strongly encourage folks to go to the Explore MVP page on the QPP website that's listed there to the left hand of this slide. And this is that is all the updates about improvement activities for 2023. So I'd like to now pass the presentation over to Elizabeth Holland.
Thank you, Lynn. Next slide, please.
Thank
I'm going to be discussing the promoting interoperability performance category. So as you've heard, it's 25% of your MIPS final score. You have the same requirements if you're reporting for traditional MIPS or an MVP. Promoting interoperability is part of the foundational level of MVPs. The performance period is a minimum of 90 days, but you can report for longer if you so choose. Most of the measures are performance-based. You must use 2015 edition certified EHR technology, and we have 4 scored objectives: e-prescribing, health information exchange, provider to patient exchange, and public health and clinical data exchange. Next slide, please. So for what's new is we've always had public health and clinical data exchange measures, but we've made a few changes for 2023. The first is the active engagement options. We used to have 3 active engagement options, and now we have collapsed the first 2 into one new category called pre-production validation. And the third option that we had is renamed for validated data production. And so in this change, we're also now requiring MIPS eligible clinicians to submit where they are. So when you report on your required measures, you would tell us which measures you're reporting on, or and you would also submit what level of engagement you are for those particular measures. And if you are reporting the optional measures, you would also need to submit your level of active engagement. Starting next year, we're going to limit MIPS eligible clinicians to spending only 1 year in the first category, the pre-production validation level, because during the pandemic, we really learned that having this data is really important to public health agencies. And so we're really trying to get all clinicians to be at the validated data production, which means that they're sending data to the public health agencies on a regular basis. Next slide, please. So we updated our query of prescription drug monitoring program, or PDMP measure. It has been an optional measure for several years, but starting in 2023, it is a required measure. Because it is now required, we've also added exclusions for the measure. So if you meet the requirements for the exclusion, you could claim it. I will say this measure is still a yes/no measure, and so it only requires you to do 1 query during the performance period. In addition, we expanded the scope of the measure to include not only the Schedule II opioids, but to also include Schedule III and Schedule IV drugs. For the health information exchange objective, we had 2 different options, and now we added a third option, which is enabling exchange under the Trust Exchange Framework and Common Agreement, TEFCA. At the time when we finalized this, we really hoped that TEFCA would be live in 2023, but it looks like it might become live late in the year, but I'm not sure it will be available for 90 days. Next slide, please. Okay, so in looking at our scoring, we decided it was not reflecting the priorities that we felt were important. As I mentioned, we think public health reporting is very important. That used to be worth 10 points. It is now worth 25 points to reflect its importance. Also, with adding the query of PDNP measure, it was optional and now it's required. So we shifted the points there as well. I will also mention under the health information exchange measure, the options are you need to either do both of the support electronic referral measures or do the HIE bidirectional exchange or do the enabling exchange under TEFCA. There are bonus points if you report to an additional public health measure. It doesn't matter if you report 1, 2, or 3, the max you can earn is 5 bonus points. Next slide, please. Okay, so I know there were a lot of questions about hardship exceptions. Applications will be able to be submitted soon, but you have plenty of time because you have through the whole end of the year. I think the submission window closes January 2nd, 2024. So don't worry about they're not available now. You will have plenty of time. We have several reasons for being able to apply for a hardship. Decertified EHR technology. I don't think that any technology has yet to be decertified. Lack of internet connectivity, extreme and uncontrollable circumstances, which includes disasters or vendor issues, and lack of control over certified EHR technology. If your application is approved, you will receive a 0 for promoting interoperability, and that 25% will be redistributed to other performance categories. However, if you submit any data, like for promoting interoperability, we will cancel that hardship and your data will be scored. Even if you just submit your cert ID, any data for PI cancels a PI hardship. Next slide. So those were the hardships that you have to take action and apply for. There are also several other instances where you could be automatically reweighted. And that's if you're hospital-based or ASC-based, based on your clinician type, and if you're part of the small practice. So yes, there's automatic reweighting for small practices. What is a small practice, you might ask? A practice that has 15 or fewer clinicians. Okay, next slide, please. So for automatic reweighting, we had in the beginning, when we added new MIPS eligible clinician types, we were reweighting many more clinician types, but certain clinician types are no longer reweighted, and those are the nurse practitioners, the physician assistants, the certified registered nurse anesthetist, and clinical nurse specialists. Of course, if any of these types are in a group, the group submits as a group, and so all the data for these clinicians would be included, including groups that include the automatic reweighting, unless the entire group is made up of physical therapists, for example. And we already discussed the different instances where you could have automatic reweighting. And again, for any of these circumstances, you're automatically reweighted, but it will get canceled if you submit data. Next slide, please. And I'm turning it over to Katie Moore.
Great, thanks, Elizabeth. Next slide, please. Okay, so this next section is about the APP. So this is really specific to our MIPS APM folks. So the APP is really just another MIPS reporting and scoring pathway for MIPS eligible clinicians that are identified on this participation list of affiliated practice list of any APM entity participating in any MIPS APM on any of the 4 different snapshot dates during a performance period. And there's a comprehensive list of all the MIPS APMs that is located on the QPP website in our resource library. And again, if you haven't checked out our QPP website, I encourage you to check out the APM section as well, and it'll list out those different 4 snapshot dates so that you have in mind basically quarterly, but it keeps in mind when those dates typically happen. Next slide, please. Oh, sorry, nope, back to the first slide. I skipped ahead too many. Okay, great. So the APP is a fixed set of quality measures and performance category weights, and was really designed to reduce reporting burden and to, as I said before, help facilitate and encourage participation in APMs. So reporting under the APP is optional, meaning that MIPS eligible clinicians can choose to participate under traditional MIPS if they prefer. However, the Medicare Shared Savings Program requires its participant ACOs to report the APP quality measure set. So ACOs that are participating in the Shared Savings Program are required to report via the APP for the purpose of assessing their quality performance for that specific program. The APP is complementary to MVPs, and as we've previously mentioned, it's composed of a fixed set of quality measures in addition to the full set of promoting interoperability measures. And under the APP, performance is measured across 3 areas, so quality improvement activities and promoting interoperability. And as we saw in that slide previously with the different weights, performance in the cost category isn't measured if you participate in the APP, so it's weighted at 0%. And this is because MIPS APMs already hold their participants accountable for the cost and quality of care provided to Medicare beneficiaries. So we don't need to require that again. Next slide, please. Okay, here we're going to really look at the mechanics of reporting to the APP. So if you participate in a MIPS APM at the individual, group, or APM entity level, you can choose, or you can use ECQMs, MIPS CQMs, so or Medicare Part B claims, CAPS for MIPS survey measure, or admin claims to collect and report your data. So when you're deciding which collection type to use for reporting, just please keep in mind that only individuals, groups, and APM entities in a small practice are able to use that Medicare Part B claims reporting option. Medicare Shared Savings Program ACOs can use the CMS web interface, which is different than other clinicians that were in certain practice sizes could in the past, but it's still an option for ACOs, I believe, this year and next year, but we can double check on that. And then so the CAPS for MIPS survey measure or those admin claims. And if you want to report to the APP as a shared savings program ACO, your planning might include things when you're thinking about this, like deciding which APP quality measure set option to report, whether you need to aggregate data for submission to CMS, or whether a vendor will be able to do that for you. And then you'll also, if you choose the CAS measure, also having to find the CMS approved vendor. So just a few things to keep in mind while you're making those decisions. Next slide, please. And here we're going to just touch on the APP performance category weights that we mentioned before. And as background, to calculate your MIPS final score, we multiply your performance category score by that category's weight, and then multiply that figure by 100 to determine the number of points that contribute to your final score for each of the performance categories. The APP performance category weights for 2023 are 50% for quality, again, 0% for cost, and then 20% for improvement activities, performance category, and then 30% for promoting interoperability. Next slide, please. And I think it's back to me. And that is it for the APP. So the next few slides we're going to just cover. We can actually go to the next one. I know we have about 15 minutes, so just hang in there while I just have a few more slides to cover, and then we'll open up the Q&A. So this is just, we pulled together some just a kind of quick getting started checklist or some things right now as we're into the first quarter of the performance year, just some things you might want to start doing if you haven't already. So first, check out that participation status lookup tool that we mentioned earlier to see if you're eligible in that first snapshot of our first performance determination period, if you're eligible to participate in the program. And then our Explore Measures and Activities tool. This is a really great option to be able to look through all of our inventory and filter and figure out which measures and activities you want to select to participate using for 2023. And then similar, but a new resource is our Explore MVPs tool, similar to our Explore Activities and Measures tool, but specific for our MVPs that are available. So the 12 finalized MVPs, and it will list out all the measures and activities that are associated with those different MVPs. So encourage folks to look there to learn more. And then, as always, we have our QPP resource library that houses all of our information, our fact sheets and user guides and policy resources are all available there. And our webinar library that houses all of our past presentations if you want to go back and kind of refresh on any of the information we've covered in past presentations. And then again, if you're included or intend to opt in to MIPS, we have some other specific resources for you there. So learn more about MIPS reporting options and participation options, and again, identify measures and activities. And then really start capturing that quality measure data because as we mentioned previously, quality data is for 12 months, so beginning January 1st. And then we always have our Quality Payment Service Center available to answer questions and really help you figure out how to participate in the program or answer any questions, how to get started. So just want to make sure folks that haven't reached out before, just want to make sure you know that resource is available for you as well. And then here's our contact information, and of course it's all on our website as well. Next slide. So just wanted to touch really quick on another way to get involved with the program is our 2023 call for measures and improvement activities processes. They have a couple different deadlines. So this is really allows clinicians, associations, societies, people that represent clinicians and their staff, researchers, anybody and everybody that wants to identify and submit measures and activities for consideration into the program to reach out to CMS. So there is a whole process for getting involved in any and all of these different processes. And just want to direct you to our call for measures and activities resources that are on the QPP resource library. So really encourage folks to get involved if you work in any of those measure areas. Next slide. Okay, and here is just all of the information you could possibly need to know about MVP registration. So there, the window is open, so it's open now. Individuals, groups, subgroups, to APM entities that wish to report through an APM, you have until November 30th at 8 p.m. to register. And again, this is our new reporting option, and you can still choose to report traditional MIPS or the APP. So how to register for this year? Individuals, groups, subgroups, MVP registrations must be submitted by a representative of the practice. APM entity MVP registrations must be submitted by a representative of the APM entity with that QPP security official role. So there are a lot of different resources on our resource library on how to submit your MVP registration. There's a form available for 2023. This registration process is going to be manual, so there is an actual, I believe it's an Excel form that needs to be submitted to CMS. If you check out that fact sheet, it will give you all of the different steps. And again, you just submit the Excel file, the form, to qpp@cms.hhs.gov with the subject of MVP registration. And then we'll create a ticket with our service center where there'll be a specific team that's really managing this registration. So they'll be able to reach out to you if they need any other information, or to make sure you are all signed up for participation in that MVP. So I know I've gotten this question previously from other interested parties. I just wanted to say here that we are intending for this process to be manual for 2023, but hopefully for next year, it'll be incorporated into our QPP login experience so that it's similar to where you log in and get your feedback, and everything is there and all electronic. And it'll be similar to if you've ever registered for our CAPS for MIPS survey or in the past for CMS web interface, it'll be kind of in that same system. So hopefully for 2024, we'll have a upgraded process. Next slide, please. And then just as well, we have our CAPS for MIPS survey registration. So again, this is where you sign into QPP, click start registration, and then it's pretty simple process where you register or you can edit your CAPS registration process. And again, we have a great user guides and information on how to do that. And I know specifically for MVP registration, we have a wonderful how-to video. I don't know if everybody is like me. I always need that visual walkthrough of how things work. So just want to make sure folks know there is a how-to video out on our QPP resource library for that. And then important thing to note here that subgroups who are interested in administering the CAPS for MIPS survey as one of their 4 required quality measures for MVP reporting will register for this measure as part of their MVP registration through the QPP Service Center. So again, there's more information about that included in our registration form and fact sheet. And the Service Center is standing by and ready to help with that whole process and answer any questions you have. Next slide, please. Okay, just a few resources that we've either talked through or flagged probably throughout this whole discussion. One thing I want to highlight here is our QPP Small Practices newsletter. So if you haven't, if you work with or are a solo clinician or work with small practices, encourage you to sign up for this newsletter. We send it out monthly on I believe it's the first Tuesday of the month. And it's just a way we target the information that we've put out on our broader QPP listserv to really get at the information that's needed by small practices to help give you a little bit extra support where we can. And again, please encourage everybody you know to sign up for the QPP listserv that's involved with the program. Next slide, please. And one more. Okay, before we, and this is just this is just our contact information, similar to for in the previous slide, but just how to reach out to our QPP Service Center. And I can't say enough good things about our agents. They're very knowledgeable, and they help talk through some tricky situations a lot of times. So encourage you, if you need help, please reach out. Next slide. Okay, and before we jump into our Q&A session here, I did want to just flag one other opportunity for getting involved with the program. We have a wonderful human-centered design research team, so our HCD team, we refer to them, and they do throughout the year do a number of research projects to help make sure that how we're developing our website and sometimes with our policies and our resources that we're really keeping the clinician's perspective and everybody that works with the clinicians and patients a lot of times keeping that perspective in our development of our resources and our tools. So if anybody would like to reach out, I believe we're going to get that. There's an email to get involved with, and I know specifically there's a link right here in the chat box to, oh, thank you so much, Kitchen team. Sorry, I got ahead of the slides. But if you submitted data to CMS for 2022 data submission, just encourage you to click on the link or reach out to our research team. We're always trying to use human-centered design research to improve our program overall. So really would appreciate any and all feedback you have, and just click on the survey here to get involved there. But and use that cms.hhs.gov email to reach out basically about anything you want to participate in. We typically do research throughout the year, so get on that list if you're interested in helping out. Okay, and with that, I know we're getting short on time with questions here, but we could probably stay on a couple minutes after. I'm going to turn it over to the Ketchum team to talk through how our Q&A session will work. Thanks.
Great, thank you, Katie. And yes, so we will now start the Q&A session. And thank you to everyone who has submitted questions through that Q&A box. We've seen quite a few come through. But you can also ask a question live by raising your hand. And just before we get started, we have seen quite a few people ask about the slides in the recording from today's webinar, and those will be posted as usual on the QPP webinar library within the next 2 weeks. So we will get started with some questions that we've seen come through the Q&A box. And the first one, Katie, is back to you just for some clarification around the public health emergency and how it will impact MIPS exceptions.
Great, thanks, Olivia. Yes, I know there was a public webinar held yesterday as well, and just wanted to reiterate here that as the public health emergency is winding down and we're still set to end on May 11th, as we stated at the beginning of this presentation, the QPP or the MIPS Extreme and Uncontrollable Circumstances application will be available through the full performance year. So for all of 2023, since public health emergency is still in effect through about half of this performance year, and our program submits data on an entire performance year, we don't have the flexibility of reporting data quarterly like some of our other CMS quality reporting programs do. We thought it made most sense to make sure we had it available for the full year. So that will still be available for all of 2023. Thanks.
Thank you, Katie. And Sophia, a question that came through for you, just asking if you can walk through how MVP scoring and weighting works. And this attendee said, especially in scenarios where the public health measures are reweighted or only one of the public health measures is scoreable.
Sure. And I think for that one, just to clarify, I think when you refer to the public health measures, you're referring to the population health measures within the foundational layer of the MVP. Hopefully that part is, I'm tracking to the right thing. If that's the case, in instances where we have those two population health measures, which are our hospital wide readmission measure or our multiple chronic conditions measure, both of those are administrative claims-based measures. In an instance where we cannot calculate those measures, perhaps you don't meet your clinician or your group doesn't meet the necessary threshold, case threshold, or group size, we do have a policy that would first look to see if either of the measures could be calculated, either the one you selected at the time of registration or the alternative. If neither one could be calculated, those two measures are attributed to the quality performance category. So we would just allow for those to be essentially that there would be a denominator reduction to give you a 0 out of 0. So you would not be penalized if those two population health measures could not be calculated for you in the MIPS value pathway. Generally with scoring and reweighting policies, we do have reweighting policies in the MIPS value pathway track. So if you, for example, as I think Ray mentioned earlier, as a part of cost, if you could not be calculated on the cost measures in the MVP, you don't meet the necessary thresholds or sizes, the weight that would be assigned to cost is then moved to quality, and quality would weigh more. And similarly, there are certain clinician types that are exempt from PI in traditional MIPS. Those carry through in the MVPs as well. So the reweighting and distributions, that happens in tandem with how it occurs for PI in traditional MIPS. And then there's also a larger picture where if you report an MVP and then your clinicians are maybe not so sure how they would do and they want to also submit for traditional MIPS, we will calculate your MVP submission separately and then calculate your traditional MIPS submission separately. And the clinician would end up with the higher of this scenario. So if your MVP score is higher than your traditional MIPS score, then you get the MVP score, or vice versa. If your traditional MIPS score is higher than your MVP score, we would give you the traditional MIPS score to count towards your final score. Hopefully that clarifies. I know we have some documentation on our resource library related to our scoring policies, and so please visit that for that.
Thank you, Sophia. And another question that came in for you, Katie, just clarification on if you know when the application window for the EUC will be open for 2023.
Yes, we are tracking to in the next couple of weeks. So if folks, again, I'm going to plug the QPP listserv. That will be how we'll notify folks once it's available. So please sign up for that. Thanks. Oh, and just to reiterate again, it'll be open until the end of the till the end of the year. So, and I think it's January 2nd, since the 31st falls on a weekend. So you'll have plenty of time to get that application in. Thanks.
Thank you. And moving on, we did get a question about the cost performance category, and it reads, will cost be calculated in 2023?
Hey, it's Ray. Yes, so costs will be calculated in 2023 if you meet or exceed the case minimum for a cost measure, and it will be 30% of your final score.
Thank you, Ray. And it does look like we have some folks with their hands raised, so we're going to switch over to the phone line. And Becky Champion, we will unmute your line and you can ask your question. And Becky, you do need to unmute on your end. Okay, we will move on. Stacy Lasso, we will unmute your line and you can ask your question. Okay, Jennifer Lammers, we will unmute your line and you can ask your question.
Hi, can you hear me?
Yes.
Okay, great. So we are in the Medicare Shared Savings ACO. When I look at my group, they all have a QP status of yes or not applicable. So that means that I would be then exempt, correct, from having to report promoting interoperability in MIPS?
Correct.
Awesome, thank you.
Yes, if you're, sorry, Jennifer, and you said it says yes for QP status?
Yeah, they either say yes or not applicable.
Okay, yes, if you're, yes, if you've achieved QP status, you're not required to participate in it.
Thank you.
Great. And Deborah Neal, we have unmuted your line and you can ask your question. Okay. Maria Medina, you can ask your question. We have unmuted your line.
Hi, I have two questions. The first one, it has to do with the submission type. Is the web interface upload directly into Medicare, is that still available in 2023?
Hi, this is Lisa Montgomery with CMS. I'm just letting you know. So if you're participating in MIPS as a group or a virtual group, the last performance period in which the web interface was available was the 2022 performance period. If you're an ACO participating in the Shared Savings Program and you're reporting under the APP and you're choosing to utilize web interface, the web interface is available for the 2023 and the 2024 performance period. So the web interface is still available, but it's only available to a subset of participants, again, who are ACOs, or I should say Shared Savings Program ACOs participating via the APP.
Okay,
thank you.
Fantastic. Thank you so much for that. My second question, because we're a small group and we're trying to submit measures for this year, 2023, but for specific measures that state registry, for example, the ACP measure number 47, does that mean that we can only submit our information through a registry?
Colleen, would you address this question, please?
Yeah, and I did just answer that in the chat box as you raised your hand, but MIPS CQM's measures, they can be submitted by individual MIPS eligible clinicians, groups, or third-party intermediaries.
Okay, but I guess my question is the submission type. If it says registry next to that measure, does that mean that we can only submit our information through a registry?
Where is that information? I guess I would ask what you're looking at that says registry.
Okay, I pulled up the specific MIPS measure. So number 47, which is advanced care planning. And then it said next to it, it said like submission type and it had registry. And that's where my question, that's why I'm asking the question.
Yeah, it shouldn't say registry. So if you want to submit a help desk ticket, we'd be happy to look into that.
Just for purposes of clarity, we don't use the term registry in MIPS anymore because our MIPS quality measures that have previously used the registry submission type under our legacy program PQRS, those measures can be reported without a registry. So we use a term called MIPS CQM or MIPS clinical quality measures to refer to that, to indicate that you can report these measures such as advanced care plan without using a third-party intermediary to report. We have a separate set of measures that are called QCDR measures, which are qualified clinical data registry measures. Those require the use of a registry, a qualified clinical data registry to report. So those are a bit different in that you are required in a sense to report through a registry there, but typically for all of our MIPS quality measures, you can report those without a third-party intermediary.
Great, and just knowing that we are a bit over, Sophia, just actually have 2 questions that came in for you, and then I think we can wrap. Just for clarification, it looks like we got a couple of questions on subgroup reporting. So someone asked if you can explain for subgroup reporting and MVPs, how do we know who can be in a subgroup together? And then just tacking on, do subgroups have to belong in the same specialty?
Sure. So subgroup formation, there are very minimal criteria involved, and the criteria is listed in I think our MVP implementation guide on our QPP resource library, just for your awareness. But for subgroup formation to occur, you need 2 or more individual clinicians. Of the individuals that are in the subgroup, they all have to be from the same TIN NPI. They have to be from the same TIN, and what it is at least one of the individuals within the subgroup needs to meet our MIPS eligibility criteria. So at least one clinician within the subgroup needs to be MIPS eligible. The minimum number of clinicians that have to be in the subgroup are 2, and there's no max. We don't have requirements that a subgroup should only be of a single specialty, or it can only include no more than, for example, 3 specialties. We don't have any criteria such as that. We do ask at the time of registration, you delineate, clarify which TIN NPIs are in the subgroup. And we ask as a part of your subgroup registration for you to describe the makeup of your subgroup. So if you have multiple specialties or clinician types, for example, if you have physicians, but also nurse practitioners and physical therapists in your subgroup, we're just wanting to know that information just for tracking purposes. There's no right or wrong answer there, but that really helps us understand how subgroups are forming over time. I think that covers that question.
Yes, thank you, Sophia. And thank you to everyone for joining. I know we are a bit over time, so I'll turn it back to Katie Moore.
Great, thanks, Olivia, and thank you so much, everybody, for joining us today and hanging in there an extra 10 minutes so we could try and get to a few more questions. So we will talk to you all next time. Hopefully you'll be able to join our next educational webinar. Is on 2 weeks from today is our PI and improvement activities webinar. So we will talk to you all soon. Thank you for joining.